We have the online interactive decision support resources, my ALS Decision Tool from Webb.
Hi, my name is Lauren Webb, and I'm the Director of Support Services and Education for the Les Turner ALS Foundation. For all the upheaval and tragedy caused by the pandemic, there is one remarkable silver lining in the ALS community. Services previously inaccessible to many are now available online. Our vision for an online interactive decision support tool became a reality when we received seed funding from Cytokinetics Communication Fellowship Grant and a generous donation from the Gilbert and Jacqueline Fern Foundation in 2020. Here are my disclosures for this talk. The Les Turner ALS Foundation is one of the largest serving independent ALS groups in the US. Our development of a decision-making tool is based upon the insights gained by our nurses and social workers during ALS care visits. As a result, we have developed and refined best practices for decision-making in partnership with a multidisciplinary team at Les Turner ALS Center at Northwestern Medicine. We also offer support group meetings, educational materials, webinars, and access to medical equipment and communication devices and need-based grants. We help families confidently navigate the challenges of living with ALS and help people every step of the way to make decisions. The objective of this presentation is to illustrate the use of shared decision-making tools as an essential component of ALS care. My ALS Decision Tool is the first of its kind in the US. Over the last 2 years, we have collaborated with people living with ALS, caregivers, a health literacy technology company, international researchers, health professionals to create a new interactive shared decision-making tool. The low levels of literacy impact access to health care and have a negative impacts on health outcomes. The health literacy data map designed by one of our collaborators at Northwestern University shows a pictorial representation of the scope of the problem. The areas in red have low levels of literacy. We see health literacy as a tool to address health equity. You can visit the site and zoom in on different states, counties, and neighborhoods. The U.S. Center for Disease Control issued new definition of personal health literacy and organizational health literacy, which emphasize people's ability to use health information rather than just understand it, focus on the ability to make well-informed decisions rather than appropriate ones, and incorporate a public health perspective, and acknowledge that organizations have a responsibility to address health literacy. From a health perspective, these definitions indicate that people and organizations can use their health literacy skills to improve the health of their communities and its members. On the slide are a list of helpful resources to better understand how to write from a health literacy perspective, and has action plans. We used a software called Readable to upload our resource guides and to obtain health literacy scores, grade level, and to rate the tone and sentiment. We dramatically altered the tone of our educational materials by just writing the word you and by just using the word you, and wrote from the perspective of a person living with ALS. We also split up long sentences and added bullet points and hired a graphic designer with extensive experience in creating health literacy materials. Dr. Anne Hogden, a senior lecturer at Australian Institute of Health Services and Management at the University of Tasmania, introduced me to her online decision tool while attending the International MND ALS Symposium in Perth in 2019. Her framework and guidance helped inform the development of our tool. Without her help, it was just remarkable, the connections and the information and the access to literature and new ideas. It really helped transform the way I thought about multidisciplinary care and shared decision-making. She also told me about the work that the folks in the UK are doing for testing a decision aid for feeding tubes. Decision support tools are useful for people who are having difficulty deciding whether to go ahead with a treatment or not, or to be choosing from one treatment or another. Unlike guides, shared decision tools prompt users to think about what matters most to them. Shared decision tools are an essential component of patient care. patient-centered care. We believe by empowering people with ALS to make early and informed decisions about their care, the tool can transform and help improve health outcomes and reduce the caregiver burden throughout the ALS journey. We reached out to Jeremy Van Tress, a person living with ALS who recently completed his PhD dissertation on resilience, self-determination, and decision-making for life-sustaining treatments. This is what he said. Your work is very much aligned with some of my recommendations I made in my dissertation. I certainly think an interactive decision tool is the best way to go for better patient outcomes without increasing provider workload. This needs to get done. I'm so glad you're working on it. Drawing on the work of researchers who have published on decision-making in ALS and MND, we knew that we needed an interactive tool in the US. Again, the purpose of decision support tools are to simplify complex medical decisions, gauge a patient's understanding of their options of accepting or declining treatment, clarifying patient preference and values related to care, address health inequities by using best practices for health literacy, and facilitate conversations between patients, family, and multidisciplinary care teams. We partner with Communicate Health to develop our online interactive tool. Communicate Health builds accessible and visually appealing products to provide access to health information that's easy to use and understand. Each product they develop, whether it's a fact sheet or video or social media graphic or a digital application, is created and met with a specific health need in mind and designed with a priority audience, and it follows inclusive design principles. They work to ensure that the ALS decision tool is accessible, empathetic, easy to understand, and designed and tested with people who use it. And so this is the development process that we followed. So let's go ahead and take a look at the non-invasive ventilation decision tool. As you go through the tool, you'll learn about non-invasive ventilation, answer a few questions to help you think through what's most important to you, and get ready to talk with your ALS care team about your options. Communicate Health conducted user testing and provided us with a summary. When asked to describe the tool, most participants use words like informative, well laid out, and clean. The tool provides multiple options or paths, and it puts the user in control. The ability to receive information about managing ALS symptoms and care, respiratory care, or nutritional support based on responses to the assessment. One participant exited the tool by selecting no on the do I need NIV in the future. And then she exited the modal. And this participant noted that she did not need NIV right now, but would likely visit the tool in the future to learn more. And so this was really important for us as we were designing the tool. We wanted to make sure that people had the ability to receive as much information or as little information as they wanted to. We also had the skip to questions button as an option where people could really walk through and think through what the benefits are and the disadvantages are for them. So on this page where participants are asked to select what types of benefits do they see and that are important to them with using this tool after they've received some education. And some participants said they like being able to select the benefits that matter to them, noting that the selection made the tool feel more personalized. Again, the whole focus is to really put people in control and to help them feel that and regain that sense of control. And a woman, family member of a person living with ALS wrote, people with ALS must feel like they're losing control. So important to be in control of your treatment. We have a quick recap section which displays benefits and disadvantages that the user selected from the previous screens. Some participants said that they would share the quick recap content with their ALS care team to have additional discussions. For example, one woman wrote during the testing said that she would use this section to talk with her care team that she was worried about having trouble breathing, but she was also worried about the cost. And she said, is this something you guys could help me with? And this is an opportunity to have additional discussions on insurance coverage, as well as providing links for additional educational materials. So again, we'll be launching 2 decision modules, one on non-invasive ventilation and another on feeding tube in 2021. Both have revamped resource guides and webinars as complementary resources, and we plan on launching additional tools next year. My ALS Decision tool will be available on our website for you to share. Complementary materials to the decision tool, along with the webinars, documents, and videos are listed here. We redesigned 6 of these guides, and they are all revamped to reflect the patient's voice and are visually appealing and easy to understand. The role that the Foundation's education services have had in improving the quality of life and outcomes is testament to both the dedication of our support services team and Northwestern Medicine, as well as to many of the people living with ALS who provided their input and feedback. We had 28 people living with ALS and caregivers who designed and tested the guides in the decision tool, as well as 34 clinicians, researchers, support service team members, designers, who all were instrumental in helping to transform our educational approach. And it took us 2 years to develop and secure funding for the community education program. Some important lessons learned from our work with Communicate Health. We learned about accessible design in the broadest sense of the term, whether someone's using an eye gaze or they colors. A lot of things go into accessible design, as well as creating empathetic language and really focusing on the words to ensure that it's clear and easy to understand, and following best health literacy practices. The most important thing that we learned is that designing and testing with people who use it. I learned so much from the people who provided their red pens to us, and it really was transformational, and it was a community effort. But one of the other really important points of this talk is that we had organizational commitment to health literacy. And this was a collaborative effort across all departments, from development, support services. Our CEO, Andrea Pauls-Backman, her red pen is fantastic. And I was very grateful for that at many points along the line. As well as the team from ALS, from the Les Turner ALS Center at Northwestern Medicine. We also had an intern, Kelly Randall, who produced 3 of the different guides and worked and ran a project for her occupational therapy capstone project. We also realized that it was really important and that we needed to focus on prioritizing promotional efforts. So much energy went into building of the tool and getting the words right and having the appropriate links. And we realized we now need to pivot and really look at promotional efforts and how to promote the tool of people living with ALS, caregivers, and other healthcare providers and coordinators to act as intermediaries so they can introduce the tool to others. So we would love for you to share the decision tool with the folks that you work with. So I think the big lesson, the big take home here, and that I learned from Ann Hogden and others, is that shared decision-making tools are an essential component of patient-centered care. And so as we all continue on this journey together, there's new ways to innovate and really to help families living with ALS make decisions. Here are some of the references. And thank you to people living with ALS and MND and their families.
Thank you, Lauren. That's wow, that's a fantastic tool that you're developing parts of it, but some of it are ready, the NIV.
Yep, it's ready. We actually just launched. We sent an email to folks who subscribe to Les Turner this morning. So we're officially live with both the non-invasive ventilation and also the feeding tube module. So we're thrilled. So this was taped a wee bit ago. So I was trying to put the links in the chat for y'all.
Okay, so the links are in the chat then to the new guides. I think it's, yes, I do think it's fantastic. Now, I know you're collecting data when people go in. So if we go in to look at it, will that mess up your?
No, just go ahead. We want to have as many people utilize it as possible. So, so I know there's some other really specific work that folks in the UK are doing, and that folks in Australia have been doing around specifically around decision-making tools. We're looking at the number of where people go through the tool, but please, anyone go on the tool. The more folks to use it, touch it, get familiar with it, it makes it real.
Excellent. I think the people have that conversation, of course, in clinic. You're having the conversation with someone, but to use a tool like this, it makes it very concrete. Plus, if they do have questions, you might think you've said everything. You might think you've covered all the bases, but if they go through that, then you might come up with where the gaps are, or where there might be a need for a little bit more education.
Yeah, absolutely. So, you can use it in multiple ways. So if you're working with a local organization who says, oh, we've had a conversation about, about non-invasive ventilation, or we started the conversation, we didn't really finish it. They can send that as prep work to be able to look at it and review. Now, some people want information, a lot of information, and some people don't. And so, right, we have to design tools that are able to meet the individual where they're at, and the caregiver might want to have all the information, right? Or vice versa. And so, our tool is kind of a way for people to select different options to get more information, but there's a lot of education that supports that. And yes.
Absolutely. That sounds perfect. People can get the level that they want. And it's not replacing the work of the people in the clinic. It's working hand in hand with them.
Yeah. And, something that I really didn't think about that the previous person, Jeremy Van Trust, said, that this could actually help reduce provider workload, right? As you're doing some education, this could be a part of it, right? It's not meant to replace, but it's meant to augment.
Right, right. So there are some questions. The first is, early intervention with non-invasive ventilation will equal higher quality and longevity, but that wasn't shown as one of your benefits. Is that?
It is on the tool. You'll see that is part of it, and that's listed as part. And sometimes it's interwoven into the tool, but it will be clear to the folks working through the tool that it is a benefit.
Okay, and is there pharmacology options on the platform?
So it's something we're looking at. And, I'd love in the chat if people want to put their options. We're looking to design what our future modules will be. This is just an area where I think there's a lot of different approaches to take, but we wanted to identify what people want. And I think, that's the pharmacology is not my area of expertise, right? So, I want to know what the people living with ALS and the caregivers really want, and where a tool could help fit an unmet need.
Excellent. Well, it looks like a fantastic tool. There may be a few more questions if you want to go into the chat afterwards. Just to see that I think there's a few other ones coming up, but we are going to have to move on to the final presentation.
Thanks so much.
But Lauren, thank you so much. It was great to see you, and thank you for that wonderful presentation.